So the most important thing is that you remember you have to brush twice a day. 80% of your cleanliness depends on how often you are brushing and the brushing technique, and only 20% depends on your toothpaste.
I have two kids. It's so difficult to stop them from having sweets and especially chocolates, and especially during these vacation times.
Right.
What do we do? How do we tell them to take care of their teeth?
For kids, it is very difficult to outrightly forbid them from having chocolate. So what you all can do is that you all can come to an understanding. This is something that is called a Swiss Bank technique.
Hi everyone, welcome to the Storyteller Studio. Today with us we have a dentist. Hi Dr. Purvit.
Hi.
Welcome to the Storyteller Studio.
Thank you.
Can you take us through your journey?
So I've done my bachelor's in dental surgery from Nair Hospital and Dental College. Currently I'm pursuing my master's in oral maxillofacial surgery, and I'm also practicing in my clinic in Chembur.
Could you please tell us how can we take care of our overall oral hygiene?
So the most important thing is that you remember you have to brush twice a day. See, 80% of your cleanliness depends on how often you are brushing and the brushing technique, and only 20% depends on your toothpaste or how much of that you've taken. So a lot of people feel that if you're using a good toothpaste or if you're using good mouthwashes, that's okay if you're brushing less frequently. That is not the case. So brushing twice a day is important. I can demonstrate the technique to you.
Okay.
Another thing that we have to make sure is that we are flossing often to clean the spaces between our teeth. Then salt application is very good for your teeth. A lot of people don't know this, but even if you take a little bit of salt, put it on your finger, apply it on your teeth and rinse it off. Don't ingest it because we don't want to raise your BP and stuff, but then just rinse it off. So that's also very good. You should have water frequently because that helps with reducing your plaque formation. See, the most important thing is that you don't have a plaque layer on your teeth. So if you apply salt, if you're brushing regularly, if you're keeping yourself hydrated, all of that is reduced.
Can you show us how exactly we should brush? The right technique.
Yeah, I'll just demonstrate it for you. What you have to do is that you have to keep your brush at a 45-degree angle to your teeth. Okay, so you'll keep it like this such that these bristles, they are entering this sulcus area, basically the area between your gum and your tooth. So your brush ka bristles should enter that area. Then you do a vibrating action, okay, followed by a sweeping motion, so that the sulcus, the tooth surface and the interdental spaces are cleaned. You have to repeat this everywhere, especially the inner aspects, because we tend to forget these areas. You have to insert your brush vertically and clean the lingual, that is the inner aspect of all of your teeth. Make sure that your brush is soft bristled. We have this thing called overzealous toothbrushing, especially with people who use electric toothbrushes. They tend to do overzealous brushing. That can cause recession of your gums. Your gums tend to go downwards and it exposes your roots. Only your crown is supposed to be clinically visible, but then your roots also get exposed. So that is actually harming you. So make sure that you are using a soft bristle toothbrush, you are using the right technique, and you are only using a pea-sized amount. These advertisements, they mislead us into thinking that we have to cover the entire span of your toothbrush. That is not true. We only need a small pea-sized amount of the toothpaste so that you can actually see where your toothbrush is going and how you're brushing.
And how many times do we brush one side?
You take 3 to 4 teeth a time. You do the vibratory strokes, you do the sweeping motion and you come ahead.
Okay.
And then also do your tongue cleaning well. Even that is very important.
Doctor, I have two kids. It's so difficult to stop them from having sweets and especially chocolates, and especially during these vacation times.
Right.
What do we do? How do we tell them to take care of their teeth?
For kids, it is very difficult to outrightly forbid them from having chocolate. So what you all can do is that you all can come to an understanding. This is something that is called a Swiss Bank technique. You can tell your kids that whatever chocolates they are getting or whatever chocolates they are craving throughout the week, they can buy and store them somewhere. And then maybe on a Sunday before lunch or something, they can have all those chocolates and sweets. Because for your teeth, more than the amount of sweets, it's the frequency that affects them more. Because whenever you have something sweet, the pH of your tooth will be altered and that can cause decay. So if you're having like 3 pieces thrice a week, that is more harmful than having an entire chocolate once. Okay, so make sure that you are clubbing all of those, you're clubbing the this thing together. You're having it on one day and you're having it before your meals, because then there will be flushing action when you're eating your meal, when you're having proper roti and rice and stuff. So those sticky food substances get washed off, and after that you can ask your child to brush. Also, it is very important that you are monitoring how your child is brushing, because you know they have to clean the inner side and you know all of their teeth. Sometimes children they get very hasty with their brushing. So you have to monitor their brushing technique and monitor when they are having the sweet.
Is there a difference between male and female oral health care? Especially also when women are aging, they are about to hit their menopause. Your body also changes, so I'm sure the teeth might also change, right?
See, this is the main difference between men and women as far as oral health is concerned. That women have a lot of hormonal changes throughout their life. Okay, and two big events in this regard are pregnancy and menopause. So, as far as pregnancy is concerned, pregnancy maybe there are a lot of hormonal changes, and that can make your teeth more susceptible to disease. Basically, your gums, there can be periodontal changes, and if not monitored correctly, those can affect the fetus as well. There are conditions called preeclampsia. If the mother has periodontitis, then that can affect the blood pressure of the mother and cause some, basically, you know, some disorders. Then there have been cases wherein term labor has been induced because of periodontitis. So it is very important that women are aware that all of these issues can arise during pregnancy through no real fault of theirs, just because you know, your hormones are changing, your gums become more susceptible. So even if you are following your daily routine, you might land up with more issues as far as your gums are concerned, and if you don't show them, then that can harm your fetus. More importantly, see, if you are close to conception, then also you should come for a dental checkup, because during your pregnancy you cannot take any radiographs, x-rays, what you know people call, because they are harmful for the fetus, and most dental procedures require x-rays. So if you feel ki you might conceive soon, if you are planning a pregnancy, then you should get a dental checkup done, so that if any treatment needs to be done, that can be done beforehand. During your pregnancy, if an emergency treatment is required, then your second trimester is when it is safest to carry any dental procedures. But then again, no x-rays for you. You should not have any x-rays done as far as teeth are concerned. Even generally, you know, you don't get x-rays, you've done sonography, you have sonographies during you know, pregnancy. So that is something you should be aware of. As far as menopause is concerned, menopause is associated with a drop in your estrogen levels drastically. Okay, so that changes your mucosa and your bone ka condition. You know, a lot of people say that women are more prone to osteoporosis when they are aging, when they are around their menopause. So that will affect your maxilla and mandible as well, right? And then your mucosa, it turns more dry. When you're around menopause, you are more prone to burning mouth syndrome. You know, you'll just randomly find women complaining that they're having this burning sensation throughout their mouth, they can't have spicy food. All of this is related to menopause. So you come to your dentist and all of this can be managed. We have salivary substitutes, we can give sugar-free gum so that saliva production is stimulated, and all of these dry mouth and burning mouth, these symptoms are taken care of. We can give topical steroids and topical anesthetic gels to the females. We have to make sure that their vitamin D and calcium levels are proper for their bone health, basically. So you know, you come to your dentist and they can prescribe these medicines if required. If any hormonal therapy is required, that can be done. So these are the changes that women generally go through, and it is important for you to consult your dentist, because we'll be able to see the signs and symptoms and then manage them accordingly. Because for women, in fact, they're also more prone to autoimmune diseases. See, there are these lesions that we call red and white lesions, like lichen planus, psoriasis. These are related to your skin lesions as well. So these, their etiology is not well defined, but they can be autoimmune related, and they are then related to stress. So all of this boils down to women around their menopause, wherein they don't understand why they are facing these symptoms. They are more likely to take stress. That will cause these lesions and even exacerbate them. So which is why it is important that you come to us. We will find what the cause of your symptoms is, manage it, and so then your lifestyle can also be altered accordingly, and your symptoms can be managed.
When is the right age for a child to get the braces on?
So So see, we give braces when we feel that there's an orthodontic malocclusion, and this malocclusion is the second most prevalent dental disease there is after tooth decay. So naturally it affects a large population, right, especially kids. Now there is an age before which you do not give braces, because if the roots are not completely formed, then we do not want any unnecessary force on them. But you should come for a consult as soon as you see some sort of malocclusion developing. Now what will you see? You might notice that your kids' teeth are too
uneven,
forwardly placed,
yeah.
or there is a gap between the teeth, or they are crooked, something like that. So now these malocclusions may be at a developing stage when you spot them, but you might delay thinking कि यार 12-13 के पहले braces नहीं कराना चाहिए, which is the general consensus. But then there is a chance that you might be able to prevent the malocclusion from settling. See, in India mostly we've seen that treatment is interceptive, and we don't prevent conditions that easily. So what you should do is that you should come in for a consult as soon as possible. Two things are possible. Either you are in a developing stage wherein your doctor can give you some interceptive measures. If your child is having thumb sucking habit, or if there is mouth breathing habit, so uski wajah se you might have an open bite, that is your teeth are not closing completely. So we can give habit breaking appliances so that before the occlusion has completely set in, before the permanent teeth have come into their final position, you correct them and guide them into the natural position. Okay. And then there are certain malocclusions which are self-correcting. There's this thing called an ugly duckling stage. 8 to 12 years ki age pe you have your permanent canines coming. So they are bigger teeth. Okay, they tend to push the roots of your front teeth inwards. So during that stage you'll have some flaring of your front teeth, and you'll see that in your child, and you might think that they'll need braces, but that is a self-correcting thing. So the moment the canines come back into their normal position, all of your teeth will settle back into normal occlusion. So we do not give braces before the age of 12 and 13, but still you should come and show once, because then if some habit breaking appliances are to be given, or if the doctor feels that some extractions need to be done so that your remaining teeth can be guided into the right position, so then that can be done at an early age.
What about the wisdom tooth? It really pains, it's painful. So should we just keep it, bear the pain, or should we pluck it out?
So this also depends on how your tooth is placed. When you'll come to us for your wisdom tooth ka complaint, we'll generally advise an OPG, which is a full mouth ka radiograph, an X-ray basically that will cover all of your teeth. So in that we can properly analyze where your tooth is positioned. If it is too close to your nerve, if it is very deeply situated, we feel that it's not going to cause any problem. Thoda kabhi kabar, thoda sa, maybe some inflammation has happened, but that will settle with antibiotics and painkillers. So we might advise that you let it be. But if it is affecting your front tooth, sometimes it is placed such that there is food lodgement, but see, this will be teda. Your wisdom tooth is diagonally placed and your front tooth is in normal position. So there are chances of food lodgement in this area, and your front tooth, that is your second molar, your wisdom tooth is your third molar. So your second molar might get prone to tooth decay, and we might have to do root canal or worse extraction for that as well. So if we feel that your third molar is jeopardizing your second molar ka health, so in such condition we'll ask you to get it removed. So we'll have to analyze and weigh the risks and benefits. A lot of times we get patients who are going to go abroad. For 2-3 years they cannot come back. And maybe right now the tooth is not causing any pain, but it's a ticking time bomb. It might give them symptoms anytime, and then there it is very difficult for them, because of financial conditions, you're not covered in dental insurance in their country or whatever. So the price difference is exorbitant.
It's exorbitant,
right?
Yeah.
So then we might advise that it's better if you get it removed prophylactically. So if there's any issue, you should just come to us. We'll take a thorough examination and then give you a treatment plan, whether to get it removed or not. But more often than not, people have to get their wisdom teeth removed, because of evolution. Actually what is happening is that our jaws are becoming smaller. Our dietary habits have become much softer. We don't have to eat raw food. So jaw chota ho raha hai, but teeth utne hi hai. So that's why there's not enough space for your wisdom teeth. So mostly they are in such positions that we have to get it removed.
Thank you so much, Dr. Purvit Vasani. It was so nice having you at the Storyteller Studio.
I had a great time as well.
And sharing so much of knowledge about the oral hygiene Thank you so much.
Thank you.